Welcome to the Reverse Diabetes Podcast, where we bring you real conversations, real hope, and real solutions for type 2 diabetes and prediabetes. I'm your host, Dr. Beverly Yates, ND, a licensed naturopathic doctor and blood sugar expert. Each week, I sit down with trusted medical professionals and health leaders to share insights, strategies, and stories to help you reverse type 2 diabetes naturally and live your healthiest life. So, if you're ready to feel better in your body, to boost your energy, to take control of your blood sugar, lower that A1C, and finally move forward with confidence, you're in the right place. Welcome. All right. Hi, everyone. Welcome to the Reverse Diabetes Podcast. Today, my guest is the amazing Dr. Sanda Moldovan. I know her through our professional work, and we also have some interesting things in common in our background. I had a chance years ago to be helped by a dentist who was very familiar with the importance not only of oral health, but also biological approach to dentistry, which really can be transformative. So I'd like to welcome Dr. Moldovan. I'm going to call her Dr. Sanda to our podcast. Hello, Dr. Sanda. How are you?
Hi, Dr. Beverly. I'm doing great. How are you?
I'm feeling fabulous today. It's really always a joy to talk to you. You really walk your talk, and you look just as glowing in person as you do on a recording, right? You literally, when you talk about that, you're not just transforming smiles, you're transforming lives. And it's
Yeah.
that kind of confidence that I think really glows and shows you know your stuff. You're not making this up.
Thank you so much. I think we have to, absolutely have a holistic lifestyle ourselves in order to help other patients. We can't just talk about it.
Right. We have to do it ourselves, right? And that's part of the learning is our own journeys on this. And with that in mind, I'm curious. Obviously, you have your initial training as a dentist. What then inspired you to become an expert in biological dentistry? And please explain to folks what is biological dentistry?
Biological dentistry is the type of dentistry that is personalized, and we look at detoxifying the mouth from microbes and metals for a healthier body through using biocompatible materials. Because believe it or not, there's a lot of dentists out there that, yeah, we do that too. We help detoxify the mouth, but then they're not conscious about what they're putting in someone's mouth. Like, for example, mercury is still being used in this country, sadly. So those silver fillings are 50% mercury. Fluoride is still being used in dental offices. We have chlorhexidine, which is like a mouthwash that's used actually for bleeding gums. It's easily prescribed by dentists, but chlorhexidine is actually a pesticide. It's also used in the field. So, in my opinion, it just doesn't belong in the mouth. We have better choices.
That makes sense, right?
Yeah,
So many
exactly.
things with that.
Yeah.
So many things.
To answer your question, how did I get here? Yes, I went to dental school, exactly right. And then while I was in dental school, I told my friend, you know something, I have these silver fillings in my mouth. I really hate the look of them. Can you like just remove them and just give me this beautiful smile? Actually, I had already started my residency at UCLA, and I hated having these black teeth in the back of my mouth. So it's like, sure, let's take them out. So we took out all 16 of them
16.
within 16 fillings. I
You
think
have
within a
32 teeth, though. That's half your mouth.
pretty much. Like when I opened my mouth, probably it's just like everything from here back, it was all black. And
Sandra,
I hate it.
wow. Wow.
And another interesting thing, I used to take a fork, put it on one of my fillings, and I would get a zinger.
Yeah.
And I understood why.
That galvanic effect. Ouch. You can have a lightning bolt out of your mouth,
As an engineer, you know that.
right? This isn't supposed to happen.
It's not supposed to happen. So that's what happens when we actually close our teeth together in a wet environment. That galvanism runs through our body and it can actually drain someone's batteries pretty quickly. And it was the same for me. Actually, I had a very low energy. And I thought that was normal, right? Because I had these feelings since I was 14 years old, living in Romania. So anyway, he proceeded to remove my fillings, and then I got really sick, and I didn't realize that it was actually from the removal of the fillings. And I had like brain fog, blurry vision, even, and for a dentist, young dentist wasn't a good thing. I was tired. I couldn't do my regular hikes at the Runyon Canyon here in LA. So finally I ran into a naturopath, and she said, well, you might have heavy metal in your blood, so let's in your system. So let's test for it. So I remember I did a urine challenge test, And I was waiting with anticipation. Oh my God, do I have heavy metals? What's going on? She already probably knew the answer, but me, I was hoping that I didn't. And when she told me, she's like, no, your mercury's off the charts. And I was shocked, and I'm like, well, why? Why did this happen? And she's like, well, because you took out your mercury fillings unsafely. I didn't even know. So I just had finished dental school, residency.
Right.
I didn't know there was a safe way to
Yeah,
remove mercury.
there is.
I mean, and I remember getting so upset. Is like, how come no one told me in dental school that this could even happen? Why are we informing patients? And also all the dentists, that we're using these mannequins in order for us to learn how to put in amalgam fillings. Nobody warned us. Now this is without a suction, right? Because when you have a mannequin, you're just drilling away, you're inhaling all that vapor. So we're getting intoxicated, yeah, even as a dental student before we even seeing any patients. Yeah, so that's how I started. I'm like, there's got to be a better way. Okay, so I started studying functional medicine, going to conferences, detoxification, and I had to go through that detoxification myself.
Hmm.
It took me a good couple of years for me to actually, get rid of those high levels of mercury and aluminum, and I don't know what others, metals were
Cadmium,
there.
all sorts of things hanging out, lead. It's so interesting you mentioned that because it is a lived experience for a lot of people, and many are unaware. And I've known of dentists who've lost their careers, unfortunately, to the very real issues with mercury poisoning. And one in particular who had been my dentist when I was in the Portland metro area, he was a wonderful dentist, but I didn't know then, and I know he didn't know either. So I'm glad that you got help and got this figured out because it's a big deal.
Yeah. So that was back in, I want to say, 2004, 2006. And going through my journey, started learning, and changed my practice slowly. I said, you know what? If this is good for me, let me try this for my patients. And, I had patients that weren't feeling well, and then, I would do surgery. I'm like, well, let's incorporate some nutrition. And I got a certification as a CNS through American College of Nutrition. And, even today, nutrition is a big part of my practice.
That's really great. What a difference it makes, literally being nourished and having a dental approach from the inside out, from the top to the bottom, results based, and, meeting people where they're at. Because I'm sure for some people, when you first are meeting with them, they might have questions. And what are some of the most common questions that you face, particularly for people who might have blood sugar issues? Because this might be brand new information for them.
Exactly. Yeah. And speaking of blood sugar, you and I, treat diabetes through different ways, I
Yep.
guess.
Yep.
I treat it through the mouth. We get a lot of people with bleeding gums in our practice, especially because I'm a periodontist, and also because people don't like to floss. But sometimes it can be more than just flossing. All right. We know that bleeding gums is one of the number one signs of that you might have a chronic disease. One of them could be diabetes. It could be also leukemia, interestingly enough. I diagnosed this only one time for this young girl in her late 20s. She's like, I would just be at the gym and my gums would start spontaneously bleeding. And I said, this is not normal. I said, let's test you. I said, you need to go see somebody who could test you, do a blood test on you. Sure enough, she actually had leukemia.
Wow. I'm glad
So,
you caught that.
yeah, bleeding gums are not something we should ignore, even though
Yeah.
it doesn't hurt. A lot of people are like, oh, yeah, so what? My gums are bleeding when I floss, but what's the big deal? Well, it's usually a sign of something deeper.
That's a great point that you raise. A lot of times, we are taught to ignore symptoms, or people in our family and friend circle might be will poo poo those symptoms because they're like, everybody's got it, right? Especially if, let's say, you have a circle of people around you who have something like diabetes. They may all be struggling with their oral health, with bleeding gums, because it can be a leading symptom, a leading sign in a disease that can, in its earlier stages, be silent. So thank you for
Yeah.
bringing that up. Sometimes these things are not obvious, but we got to connect the dots. So when you come to see a professional such as either one of us to help you assess, hey, you may have another problem here. Let's do a further explanation or refer you to wherever is appropriate so we can find out if that is part of what's going on. Because as you said, chronically bleeding gums is not normal. Something's going on. Why
Yeah.
isn't your body healing? Do you have other infections? What's going on with your immune system? All of these point to diabetes and blood sugar problems.
So, so important. And especially, people might be saying, oh, you know what, maybe I should start flossing. Great idea. For some people, they have really big hands, so I do want to give some tips here, like
Sure.
how to do like proper hygiene at home, because I did not know how to properly brush my teeth until I
Okay.
went to dentist. That's how I ended up with all those mercury fillings in my mouth to begin with. I had a sweet tooth, and it really decayed my teeth. I ended up with fillings, and I had no idea what floss was until I went to dental school. And what's interesting, people who don't like to use string floss, the good news is studies on the water flosser.
I was going to ask you
Uh,
about the water flossers. Go ahead. Before we continue with today's discussion, I want to take a moment to share something that could really support your journey. Struggling to lower your blood sugar or wondering what to eat next? You're not alone, and you don't have to figure it out on your own. Be sure to download your free copy of the Guide to the Yates Protocol: 5 Steps to Fix Your Blood Sugar and Reverse Type 2 Diabetes Naturally, to take the confusion out of your next steps and help you get real results. Download it now using the link in the description and start feeling more confident, more energized, and more in control of your health starting today.
yeah, perfect. It actually showed that water flossers can be even more effective than string floss. So super important. You have big hands. You don't, you hate to floss, which is pretty much everybody. Use a water flosser, and all the studies were done with just at a medium power with just water. You don't have to put anything fancy inside or a mouthwash. And what's interesting, USC has done studies on this as well as Tufts University. The pulsation of a water flosser actually can go up to 6 millimeters under the gum.
Wow.
But we just have to point it in the right direction, right? So super important to actually have it just slightly into the gum area. And full disclosure, I started a natural oral health company called Orasana. And if you want to watch how to properly use a water flosser, we have great videos on there. But nowadays with water flossers, it's easier if the tip has these tufts, so you can put it next to the gum, so you can walk it along the gum and kind of stop in between the teeth for a couple of seconds. Don't just kind of rush up, back and forth, back and forth. Just stop in between each tooth and let the water go through the other side, because that's how it flosses in between the teeth. And we really see like being 80% more effective than string floss.
That's really great to know. And for anyone listening to our podcast, we'll have links in the show notes to all of the things that Dr. Sanda is talking about. So you can go and see these videos. If you're interested in the products, you'll be able to purchase them there. One of the things that I've always appreciated with my dental colleagues, whether it's been the actual dentist, an oral surgeon, a dental hygienist, is the willingness to teach as you go along. Because a lot of times people have misperceptions, or sometimes maybe from childhood they had not good interactions maybe with someone in a dental office, and their fear often will keep them from going to get help. Or maybe somebody is in a place where they've had experiences where they've been shamed, blamed, judged. Maybe they felt very stigmatized, and so they don't ask for help. And by the time they come back, it's usually a much more serious problem.
Yeah, exactly. And good oral hygiene starts at home.
Mhm.
So if your gums are bleeding, you can do something at home. Let's say you don't have a biological dentist in your hometown, just start at home, like brush. I always say use a calcium hydroxyapatite type of toothpaste or tooth powder, because that's really helping to mineralize the teeth. Then use a water flosser or string floss, whichever one you prefer. And then always say if you have a white coated tongue, bad breath, pop in a chewable probiotic to help to stabilize the oral microbiome. We're dealing so much today in our practice with the oral microbiome. You understand it more. And what does that mean? Oral microbiome is really the layer, the biofilm that lines our cheeks, our tongue, our gums, the teeth. And we want that oral microbiome to be healthy. We don't want a sterile mouth, but we want it to be healthy, so it protects from cavities, it protects from gum disease.
Absolutely. Literally from the inside out and the outside in. And the oral health, this mouth, is your opening airway, your opening tube, if you will, pipe from the mouth all the way to the exit out of the rectum and the anus. There's a lot that goes on, but this is step one. So what's going on in your mouth really sets up your health all over the whole body. And I think it is greatly underappreciated. One of the strangest things I've ever really had to think about is why in the world for the US healthcare system it doesn't include dentistry. It's always a separate insurance policy, just like for your eyes or care for your ears, the same for your mouth. as if this isn't all part of our body. It's very weird to me.
So I have a feeling it's not the U.S. healthcare, but it's that ADA has a big lobby, politically speaking, and I think they're just trying to keep it out of that so they can, so have more maybe fee for service practices, but it's not helping the population. I think when I talk to our European colleagues, they have such much better health and dental insurance, kind of all bundled up into one, like you were saying. They do have higher taxes, but at the same time, they have better insurance.
They're getting something back for it. I feel like we're making
Yeah,
it too hard for people to be well. And when you
yeah,
look at how easy it is to get wildly high levels of sugar, salt, etc., in the things that we drink, the things that we eat, wow, this is not helping.
yeah, exactly. And a lot of people are, cannot afford to spend thousands of dollars, going to the dentist. So that's why I encourage people to really kind of take your health in your own hands and use things at home, tools that can help maintain the teeth and the gums healthy. Because essentially that's really at the core of oral health. Good nutrition, good oral hygiene, good lifestyle, reduce stress, right? Because stress also has an effect on the teeth.
Yeah.
So yeah, I mean, I know in dental school, I was clenching my teeth because that tends to be very, very hard on teeth. So actually protecting them, uh, and how do we protect them right from stress? That's a tough one. Night guards are basically a good tool. I call this the best insurance policy to make sure people don't crack teeth, because I have seen people clenching and actually fracturing a perfectly healthy tooth, like a vertical fracture. So now it's like we can't save it. We have to remove it.
Wow. Yeah,
Yeah.
definitely. I can understand that when people are feeling really stressed, lack of whatever it might be, resources, just too much emotional tumult, whatever it might be, um, that kind of pressure, to crack a tooth. Wow, that's a lot of force. That's not the easiest thing to do.
Yeah. So studies show that people that clench at night can put up 5 times more forces on their teeth than when they're chewing food.
Wow.
So it's pretty dramatic. And why, if we really were to get to the root, and I always like to get to the root cause of why do people clench. Stress is one of them, but what can create stress? Yes, the daily life, but the inability to get enough oxygen at night is stress on the body, which creates it to then clench, right? So I'm talking about, of course, sleep apnea. People who don't breathe well at night will have that feeling like, the brain is, oh my God, I'm stressed out. I'm not getting enough oxygen. So I definitely, that's a big part of my practice. One of our pillars of treatment is um, treating sleep apnea either with a mouth guard or night guard that advances the lower jaw forward, or we actually have this really cool procedure today developed by this dentist in Florida called a NightLase. Have you heard of this? I'm not
No,
sure if
no,
it's
spell that one out. I want to make sure I heard you correctly. A night.
yeah. So it's NIGHT, night lace, LASE.
Okay.
NightLase. Not the best name. It almost indicates like you're cutting something, but we're not cutting anything out. That's the cool part about it. NightLase procedure is done with a specific laser called photona. And I got interested in this particular procedure because for my husband and my mom, they both, my husband started developing mild sleep apnea, because what happens is, as we get older, our ligaments in the back of the throat, just like anything else, get more laxity. And my mom had moderate sleep apnea, which caused her to have hypertension and arrhythmias. So by actually treating sleep apnea, we were able to decrease her blood pressure. And actually, she was able to lose some weight, which is also, a cause sometimes.
Yeah.
Yeah. So
That stress
vicious
the
cycle.
body perceives from not getting in the oxygen causes you to gain weight because your body thinks you're under threat. Therefore, your metabolism is on full on emergency, and here come the pounds, here comes the extra blood sugar, problems with your cholesterol, problems with your blood pressure. You are naming all the things. Please keep going. This is great.
Yeah, so what do we do for nightlight? So I first do a cone beam CT scan because I want to see the airway. I want to see what we're dealing with. And then, of course, I need a diagnosis from a sleep doctor. Okay, what kind of sleep apnea? And nowadays, the monitoring for a sleep test is so easy. I know because my husband did it. So we actually put a little sensor on the index finger. We taped it for 2 nights in a row. We worked with a company called Sleep America, and they got the data via iCloud, and we got a report saying, okay, this is how many times we had apnea episodes, and how do they know? Because they actually look at the oxygen level in the index finger. And based on that, we either do 2 sessions or sometimes even up to 5 or 6 sessions, depending the severity of the sleep apnea of this laser treatment. What does the laser treatment look like? I actually treat the ligaments of the tongue to help to tighten them. So it's a non-cutting laser. We just actually tighten the ligament of the tongue. And then it also lifts up the soft palate, or the back of the roof of the mouth, especially for people. And I encourage everybody listening, just look in the mirror, stick your tongue out, and see if you can see the opening of your airway. If you cannot, most likely you've got a problem with sleeping. So it lifts that up to where, let's say after 2 sessions, I could already see a lift in the back of the airway opening. So people can breathe better at night. I have some patients told me even after the first session, they finished the session, they said, I don't know if it's my imagination, but I already feel like it's, the back of my throat is more open.
That's
This
great.
laser technology is really incredible. It just basically shrinks the collagen fibers, it tightens them, and in that it lifts the roof of the mouth and the tongue. It just tightens it to the back of the throat so it doesn't fall in the back and close
Mm.
the airway.
That makes sense because that upper airway, that palate, like you said, you open up your mouth and you look in the back, and if you can't see that little punching bag in the middle called like the uvula, that back air area, if it just looks collapsed and small, you do have an airway problem. So it's you're trying to get your normal air through a much smaller opening. Probably when you were younger, it was like that, and now it's like this. Big difference, right, in the flow of air.
Big difference, exactly. I'm also actually seeing kids
Yeah.
nowadays with swollen tonsils. They
Mm.
cannot breathe. They cannot breathe. And the nice thing about this laser, it also helps with those enlarged tonsils. We can actually shrink them so they can sleep better.
That's great. That's great. I have seen some kids at times have problems with their airway, and they're like 5 years old, 7 years old. You're like, whoa, what is going on? So, question for you: with these treatments, do they happen like multiple times in a day, or does it have to be spaced weeks or months apart? What's the interval between treatment?
Yeah, great question. So it's actually the recommended time is 21 days apart,
Okay.
because that's when they notice that we get the most tissue changes and we can piggyback on the treatment. So, but if somebody waits, let's say 5 weeks, I have patients that come from out of town who visit me at the practice. They cannot come back exactly at 21 days. That's okay as well. But the most effective way is at the 21-day.
That's good to know. That's good to know. People could plan for it. Okay. That is good
Yeah.
to know. I
Because
had
you're
not heard of that lays before, so that's helpful.
Yeah, I mean that's the nice thing about it. You're done with the treatment. People have no soreness of the back of the throat. They could just go. We just say don't drink anything cold because we're trying to keep the energy of the laser in the back of the throat. But other than that, people have no symptoms.
That's great. Well, who doesn't want that? Okay.
Yeah,
So, how
exactly.
long does this last for? Is this for a few years, like a decade, more than that, lifetime?
So what this doctor noticed, doctor in Florida that invented this technique, he's been doing this for 10 years. I've been doing this, I want to say, about a year and a half. I haven't seen anybody come back yet, but he's noticing after 2, 3, sometimes 4 years, as we get older, we need a one session as a refresher to help the tissues tighten again, but never the whole series again.
Interesting. So, if somebody goes through this, let's say they're on a CPAP, they go through this series of treatments, and now their airway is looking better. They've got space back there. Are they able to not use that CPAP, or what happens with that? Because I know if somebody's listening to this has sleep apnea is going to ask that question.
Exactly. And we have lots of patients on CPAP that come to see us. I cannot tell them I guaranteed you'll be able to get off of it, but most of our patients were able to get off the CPAP.
Okay. And then I'm
Yeah.
imagining there's changes in their blood pressure, whether or not they're off the CPAP, because if they are on a CPAP and that wasn't enough to help their blood pressure, this might be, it sounds like the thing that could help put them over the top, whether or not they have to continue to use the CPAP. Am I hearing that right?
You're absolutely right. And actually, I've asked, in a questionnaire, people who are using a CPAP see a significant decrease in pressure, even after the first session of NightLase.
That's great.
So that's very encouraging.
Yeah, and therefore there's less danger and risk to their heart because, oh boy, the effects of sleep apnea on the heart are terrible, along with your weight. So if you're struggling with your weight, you're doing all the right things. You're probably frustrated out of your mind with that whole setup, and you're realizing, look, there's this residual heart damage, blah blah blah. This might be a viable option for you. I'm so glad you shared this because I know a lot of times people are like, damn it, I'm doing all the right things. Why is this not working?
Yeah, so you might find like if people are listening, wondering if there's a doctor in their neighborhood, they can go to the Fotona website, Fotona, and you can find a doctor in your area, a practitioner that has a Fotona laser and can do this procedure.
All right, great. We'll put that in our show notes as well. People, check those show notes. Everything she's talking about, we're going to make sure it's referenced so you can easily get to it. And please share these episodes with your friends, your family, others you know who care about their health, because there are so many more options in today's world. But sometimes your typical Google search may not turn that up for you, especially with now these AI summaries that often miss these kinds of nuanced but very important options. They might not come to the top of that search page.
So true.
Yeah.
I want to tell somebody, speaking of the show notes, I'm going to offer everybody a copy, a downloadable copy of the Detoxify Your Mouth booklet.
Yes.
Basically, I go over the oral microbiome, how to test for it. We go over mercury safe removal, how you can find a dentist to remove it safely. We go over root canals and cavitations and what to watch out for, or how to make sure your root canals are still in good shape, and a lot of other information, which is beneficial for everyone.
Yeah, that's a valuable resource, friends. I hope you make use of it. I'm certainly, living proof of the benefits of oral health along with biological dentistry. Before my husband and I decided we wanted to have children, I went through, actually both, we went through a whole body cleanse, series of cleanses together. And in addition, at that time, I had two of the mercury amalgam fillings and I wanted to have them removed. And by then I knew enough to make sure they were removed safely. So I went to see a biological dentist. I was living in the Seattle metropolitan area at the time, and he did all of the protocols that I'm aware of for safe extraction of the mercury amalgam dentistry. And then I went through additional testing to be sure did I need chelation? Was there any residual heavy metal toxicity? Once we got all of that figured out and through that process, then we went to conceive children, and I'm happy to say they're both alive, happy, and well. I say, lucky in me, I got away with something good later in life. At that point, I didn't know that fertility can drop so precipitously as we age because that wasn't what I'd seen in my family or in my community. So, pregnant at ages 38 and 40, and babies at 39 and 41. So, I'm going to knock on wood. Lucky
Amazing.
me. But I'm really glad for the work that you do because I really feel like that was part of that journey to help have healthy kids. I also grew up in South Philadelphia, and at the time, it had these massive oil refineries. The air some days just stunk, etc. That was not a healthful environment to grow up in. Talk about something to set you up for insulin resistance and type 2 diabetes. Then, when I reconnect with my biological father, I've discovered that he's one of 13 siblings, all of whom had some kind of diabetes, including type 1. I'm going, oh my God, I've really got to pay attention to
Oh,
metabolic health. Here's the good news, being an athlete, other things. I've been doing the things, but now at least I know why. So when I, left the world of engineering, became an naturopathic doctor, I was like, this is the other part of the puzzle, right? So I really feel for you, Dr. Sanda, the work that you're doing, your own lived experience with the fillings, the fact that you knew something wasn't right and yep, you were toxified and then you became detoxified. For those of us who've been on that journey, we really feel like I think a duty to let the public know. How do
yeah.
we make this better for yourself, for each other? Because this stuff is not obvious.
Yeah, yeah, absolutely. And I think we absorb toxins, like you said, the air we breathe, the environment, and we have to detoxify on a regular
Yeah,
basis.
yeah, yeah, definitely, definitely. Are there any symptoms or signs that a person might experience that would be a really good clue that they need to go down this path and do some more figuring out of what's going on with their oral health? You've talked about sleep apnea and sleep apnea risks. You talked about fillings and the fact that yours had changed color and clearly something wasn't right there in your mouth. What are some other things people could experience?
Yeah, I definitely want to talk about chronic fatigue and brain fog. A lot of our patients come in with that. And usually people don't think, oh, there must be something wrong in my mouth. They say, oh, maybe it's my hormones, or, maybe it's I'm not getting enough sleep, or, so then they go to a physician, usually not a naturopath, unfortunately. So then they go down this path and they do a lot of tests, but they still feel brain fog and inflammation and chronic fatigue. And I highly encourage, if you feel that way, definitely see a biological dentist to do a cone beam CT scan. That's the best way to diagnose. And what do we look for? Silent chronic infections that you don't even know you have. Where are these coming from? Could be a root canal that's been there for a long time, that all of a sudden now bacteria has kind of grown inside of it and spilling into the bone. And oftentimes people have no symptoms, or cavitations. And cavitations are also microbe based, and they can be an area where a tooth was removed. For example, I had this young patient that actually had her wisdom teeth removed, and shortly thereafter, within like 3 weeks, she broke out into hives.
Hmm.
She started having immune problems, chronic fatigue, um, a lot of acne. 5 years later, she finally gets to me, large cavitations, basically holes in the jawbones that never heal.
Ooh.
And now they're full of microbes. One root tip still broken off in actually her jawbone. Um, and the practitioner who finally referred her to me is somebody who's worked with me before and knew that, her symptoms are related to oral health.
Yep.
So super, super important, because what we're doing as biological dentists, we're removing the burden off the immune system so your body can heal. Because I think there comes it's like the drop that spills the bucket. This was just too much for your body to handle. And it's just so, so important that we check the jawbone for microbes.
Yeah, when you talk about spilling the bucket, like it gets to overflow, right? Our bodies do an amazing job at trying to compensate, but they do get overwhelmed, right? When you hit your threshold, whatever it may be. I know my mother's journey with dentistry was not a good one. And unfortunately, she ran into an unethical dentist who removed her gold fillings and replaced them with the mercury amalgams. And her health
Oh my
went right
gosh.
off a cliff from there on. Then she suddenly had, severe rheumatoid arthritis. That's where the onset was. She had hypothyroidism problems. Her parotid glands were swollen and stayed swollen, on and on. And you know what the big breaking point was? Because at this point, I was early in the journey with becoming a naturopathic physician. I'd left engineering. We took a trip together, she and I, to Germany and France. And we spent a week in Germany for a biological medicine week. It was life changing. And she was there with me at every session. I am still so grateful. I just like, it was one of those moments I feel like where God just blessed us. We were together, this mother and daughter, and there were times where she was crying. She was so upset. Long story short, she came to understand that so many of the symptoms she had were coming from her mouth.
Oh, wow.
It was really clear from the various things that had been presented during that week, especially the dental sessions for oral hygiene, and more than oral hygiene, really oral health at the systemic level. And when she came home, the first thing she did was get those mercury amalgams out of her mouth, which really helped take some of that burden off. Um,
Uh,
Long story short, obviously we wished we'd known more sooner, but we didn't. We didn't know. We're talking about decades ago, right? So hopefully
yes.
people are hearing you and listening. And because I really feel like our dental health, just like our vision and our oral, as in ears, AURAL, it really gets neglected, but it's all part of us, right? And we need to be well for all of it, not little bits here and there, you know?
So true. I
Yeah.
agree with you, Beverly, and I'm so glad that for inviting me on your podcast to be able to bring awareness to this. I feel there's just so many more people that are spreading this news or old news about toxicity and mercury,
Yeah.
and we have to. All healthcare practitioners have to look in the mouth.
Yes, and know when it's time to refer people. So, for those of you listening who are health and medical professionals, please know what lane you're in and when it's time to refer, and then who would you refer to, because that's always helpful too, right? Rather than just
Yeah,
send people off into the wilds of Google.
yeah, exactly, absolutely. It's not like, oh, go see a dentist. No, if you see like silver fillings, definitely
Yeah.
remove them with safe. Yeah.
Yeah, we can do
So
better now, and things aren't wildly out of cost range either. People might be surprised at the difference. It might be $150 difference, but it could be worth tens, if not hundreds of thousands of dollars to your health and your wellness and your lifespan. So, just saying,
exactly.
sometimes we want to invest because it's going to pay you back. All right.
Yeah.
Dr. Sanda, thank you
Absolutely.
so much for being here and being our guest today. This has been so insightful. I appreciate that you are always so uplifting and positive, inspirational. And I learned something here. I didn't know about that photonalaise. I'm going to check it out and make sure I share that with other people that I know either have sleep apnea or sleep kind of problems, airway compromise, whatever it might be. Thank you so much for the work you do in the world. I appreciate you.
Thank you so much.
Thanks for listening to the Reverse Diabetes Podcast. I hope that you're walking away with new insights and the encouragement to take your next best step. If this episode helps you, please take a moment to subscribe, leave a review, and share it with someone that you know. Before you go, don't forget to download your free copy of the guide to the Yates Protocol 5 Steps to Fix Your Blood Sugar and Reverse Type 2 Diabetes naturally. It's the same proven framework I've used to help thousands of people get real results without extreme diets or expensive medication. Check the link in the description below to grab your copy and take your first step toward better blood sugar control today. Until next time, stay consistent, stay hopeful, and keep moving forward. Remember, this is about progress, not perfection.